What are some of your normal everyday diet choices and/or the foods that are science-backed for cardiac and vascular health? So my own diet choices are about a lot of things. Of course, they include what is right for cardiac and vascular health because that's my jam. But I think that my approach to all of this is much broader, and people get confused by this a lot because I don't make the same recommendation across the board. If you have watched my channel for any length of time, if you have seen me on other podcasts, you are probably aware that in general, I tend to skew a little bit towards therapeutic carbohydrate reduction because I see a lot of patients with insulin resistance and diabetes. And it is one of several approaches that is evidence-based and works pretty well. It tends to be the one that is pretty well tolerated and is easy for compliance, but it's not the only one that works. I personally don't eat grains and I don't eat a lot of starch because I find that I have a hard time controlling my total energy consumption if I eat those foods. That is not because they're evil. It's just it's a me thing. And I do find that it's true in many of my patients as well. I've done it all. I have gone low fat. I've done fasting. I have done carnivore. I have done all types of approaches to my own nutrition. Right now in April of 2026, what is working for me is a lower carb approach, lots of vegetables. I'm trying to increase my soluble fiber intake, and I am trying to stay toward fish and lean meats rather than a lot of the fattier cuts of meats. I'm trying to use olive oil and avocado oil if I'm cooking, but I'm not afraid of a little butter. I'm not afraid of a little coconut oil. Also, my cardiac risk may not be what yours is. So we titrate our nutrition to what is going on in our own personal health, what is going on around us. I also am doing a big strength training push right now. I am working really hard to increase my compound lifts. So protein is a big deal for me, and I am working hard to make sure that I am getting an adequate amount of protein to meet my exercise goals. And there are days where, like yesterday, I was in the operating room for about 12 hours. I might not have met those, my protein goals, but I have to figure out how I eat to accommodate that. And so sometimes I will supplement with protein shakes or some other things that are a little bit more processed. They are a little less whole foods than I would optimally like, but that's the reality of my day-to-day life. And I think that encouraging people to achieve a diet that is the way that I eat today is the way I can foresee myself eating for the next 5 to 10 to 20 years. If you are not eating in a way today where you could sustain this for years, then it's probably not going to work for you, right?